Welcome, Dr. Matthew Brown, to the Dish with Dina podcast. It's such a pleasure to have you on here today.
Yeah. Thank you so much for having me. I really appreciate it.
You and I were just talking about how we know each other, and I am thrilled. Will you tell our listeners, our followers, how we are connected?
Yeah. So my business mentor, awesome lady, Stephanie Telebasa, she highly recommended me to you. And so I was like, yeah, I'll reach out she always has the best advice, the best connections. So yeah, so that's how I got introduced to you.
I love it. I was sharing with you that Stephanie was my initial first ever episode on this podcast, and we have remained quite friendly and close and connected. And every now and then we just check in with each other, and she's so fabulous. So I will definitely be linking that episode to this episode for anyone who wants to go back and hear how it all started way back, 4 something years ago at this point. So, Dr. Matthew, let's talk a little bit about what got you into your current field, your area of expertise, and what led you in that direction.
Yeah. So I initially, when I went to college, I was actually going for a business degree, um, and I hated it. I hated my classes. I thought it was boring. So I switched. I took a year off, and I was trying to figure out what I wanted to do. And so I started to contemplate, putting together things that I liked the most and that I was passionate about. And so I came down to I want to help people, and I'm very active in health and fitness, and I played sports growing up, so I wanted to be able to help people in that type of field. So I started researching. It was like athletic training or it was physical therapy. Athletic training requires a lot of on-field time, and I didn't really want to do that. I like on-field time, but I didn't want to do that for a big majority of what I was gonna do. So I started going down this physical therapy path, and I absolutely loved it. Just I started liking my classes. It just felt right. It felt like what I was meant to do. Um, and the further I got into it, the more I loved it. So I actually went to ASU and I got my degree in kinesiology. And then from there, I went to PT school here in Glendale, Arizona. So I'm a native to Arizona, born and raised, spent all my time here. So I went to PT school there, got my doctoral degree, and then I moved to Tucson, Arizona, and I actually went into a sports residency. And so I got very involved in sports. I did some on-field stuff, and that's where my whole background is now, is helping more active individuals and sports enthusiasts get back to the higher level of activity that they do in this rehab profession. And yeah, ever since I've stepped foot into this profession, I've just absolutely loved it. So that's kind of how I ended up here.
It was meant to be, all of that.
Yeah.
What's cracking me up a little bit is that you are currently an owner of your practice and you did not love the business degree that you're going into. We're going to talk a little bit more about some of the details about that, but can you tell us now how that feels? Like, what are the things that you needed to know in developing a business and even starting a business?
Yeah, so I actually knew I've always wanted to be my own boss, my own owner. I just felt like I didn't want the broad aspect of business in the education world didn't feel like what I wanted to do. So for me it was more I didn't want to just be a business person. I wanted to have some sort of skill niche that I enjoyed as a profession, and then to grow that into being my own business, my own professional. Um, but yeah, so in PT school and in residency, you don't learn anything really about business. We had like one class in PT school, and it really wasn't anything specific. Didn't give you the tools to be able to be your own boss. So coming into it, I really didn't know anything. Uh, I was just gonna kind of wing it, and I mean, I've researched, and in my position before, I was a manager of a clinic, so I I got the ability to see the other side a little bit, but it was for an insurance clinic, which I don't know how much you, well, if you're in counseling and all that, you have the insurance world and you have the cash pay world, right? So they're two completely separate things. So I grew up in my profession in the insurance world. So it's completely, you learn some stuff that'll apply, but not, doesn't really translate completely. So coming into this, I wanted to do cash pay because I wanted to get the quality of care for the clients. And so I could not be burnt out and actually enjoy what I do. Because in turn, that still gives me the better quality to give to my clients. Um, so it was, yeah, there was a big learning curve. I'm only a year and a half into it. So one of the biggest things I did that's been helpful is actually work with Stephanie, because she's done it, she's been there, she's helped me develop the skills and the systems and organization to actually grow a business, not just work for myself. That's kind of the biggest key, was learning the difference, because there's a lot of solopreneurs, right? It's, you can go and just work, but I want to build a business and it's different. You have to be able to do different things and replicate it without me being there. So that was probably the biggest thing to learn, is the difference, and then all the other little things that come with that. Everyone tells you how hard of work it is and how much work you have to do, but you don't really know until you're doing it.
This is no different than the dietetics field as well. Stephanie and I think, have actually compared notes on some of those things. So for anyone listening, our audience sometimes comprised by a lot of dietetic students, interns, newly credentialed dietitians, also people in the health and wellness space. But listen, even if you're not, even if you're just part of the general population, you probably went to school for something that you may or may not be doing right now. So the thing is, there's only so much that your academic career curriculum can teach you. The street smarts to things is much different than the book smarts to things. And so sometimes you don't necessarily, like you were saying, like you didn't love how it felt to be in the business classes in school, but you knew there was going to have to be some sort of business savviness once you decided to move forward with this. And a lot of times when we go to school for things like this in the health and wellness space, it's, they're gearing us up to be working in some sort of facility. But
Yeah,
lo and behold, we are the ones that have now built our own facilities, so to
yeah,
speak. And so I love that you are pairing things up, and you're also not necessarily afraid, which this has come up as a theme a lot of times in these episodes, where fearlessness is something and setting boundaries is something that we talk a lot about, where you're not afraid to reach out and get a mentor, but you're also not afraid to just hit the ground running and figuring things out as you go. I think a lot of times people get very caught up in the minutia or the mindset of, I'm not ready yet, but when will you ever be ready? So
yeah.
just as a side note, if you had to tell somebody a little nugget piece of advice, especially from things that you've been learning yourself right now, who might be interested in taking that first step for whatever it is, switching careers, opening up a business, what might be that thing?
You're gonna learn the most once you get going. You have to just start. And that doesn't mean you have to, jump ship completely, right? Like I didn't jump ship completely. I had a little bit of a backup, not a backup option, but a backup option for me to make some money while I got this going. But if you wait too long, it's not going to change. It's the same outcome's going to happen. You have to learn as you go. You can learn, you can read all the books, you can learn from everybody, but it's never gonna translate until you actually do it.
Yeah, I agree with that. I'm very much, I like information gathering, and I'm often a little apprehensive about the execution of the plan. I'm like, give me a minute. I still have to finish this chapter or whatever. But you're 100% right. I don't think anybody's ever going to be ready to take that first step, but just to take that step. And actually, that helps with the momentum and then figuring things out. Oh, like, oh, I didn't realize that this would be a problem that would arise, or this was something that I could critically assess and evaluate and make something better or different out of that. So it behooves us to take those chances so that we can gain expertise and experience in order to make ourselves better at what we do and improve the quality of what we do as well. I love
Yep.
that. Thank you, Matthew. So share with us, what is a current or typical, I don't know if there is a typical week in the life of you. Right now, how many people are you seeing? What are like kind of the niche populations that you might be working with and other things that might come into play when it comes to owning and operating your own business?
Yeah. So I see the maximum I can see is 25 a week, 25 clients a week. We do everything in hour sessions. I typically see anything anywhere from 15 to 25, depending on how busy I am. I treat Monday, Wednesday, Thursday, and then Saturday mornings. So that's my treatment schedule. Tuesdays and Fridays, I go and in the morning I go to this gym that's close by. That's a partnership of mine, and I go there and I do manual sessions with their clients at their facility. I'm actually looking to expand with them as they grow. I'm actually going to bring my second location in with them. But so it's a networking slash providing some value to their clients partnership that we have built there. So I do that Tuesdays and Friday mornings, and then Tuesday afternoons and Friday afternoons are my admin days, which comprise of all kinds of different stuff. Catching up on notes, home exercise plans for my clients, networking. I do a bunch of networking stuff when I can, when I'm not totally slammed. Marketing, so social media stuff. And then I work with a yoga studio that's pretty close to me. And I go and teach some classes there on Tuesday nights, and I do some partnership with them as well. Uh, so that's, yeah, I'm like 8 to 5 every day, and then I'm 8 to 1 on Saturday. And that's like the typical schedule for me.
And that's a do you keep to that? Like when you were first ramping up, did you have to have a little bit more flexible? I mean, we're never really off when we're running a business, but did you have certain boundaries that like I will not let this seep into because you have a personal life, family life, et cetera, home life that you want to maintain? Were there certain boundaries that you had to set with yourself and with other people?
Yeah, so early on, I set boundaries. So I have 2 daughters. So me and my wife have 2 daughters, and we have 3 dogs. We actually have a baby boy on the way that's still cooking in the oven right now. So, so I have a very busy personal life as well. So the kids get done. My wife works as well. So I try to be done by 5 each day so I can be home with her and the kids. So I can help with taking them to school, daycare, and such. Recently, I've set a bigger boundary of the admin and other tasks that I have to do to not have those at home all the time. Because, like you said earlier, right? It's not like we can work all the time. We really could. So I've had to set some boundaries so I don't work all the time, even when I'm home, because I don't want to take away from my personal life. That's why I built a business so I could have some freedom. So I got to make sure that I maintain that. So that was the bigger thing recently that I've had to set a boundary is not taking so much home to work on, and knowing that it's a never ending list. So you just have to triage it and
Exactly. It'll never end. That inbox is always going to be full, even if we try to tend to, because there's always income, which is good. There's incoming things and opportunities, etc. I did read on your website your thoughts about insurance versus self-pay, and I have thoughts about that too. I am currently credentialed with a variety of insurance companies. I have my opinions about that, which I'm not in love with doing it. It just gives me an opportunity to have a broader reach to certain people and certain populations. Every insurance company is different, every state is different, every provider is different. If I give an example, just today, I had two separate clients, two separate insurance companies, and one was unlimited amounts of visits for $0 copay. That's it, nothing, right? So free anytime you want to come see me. And then the other one was 3 hours max and zero copay, which, okay, Is anybody hearing this? Right? 3 hours max. How can I possibly, like, that means 3 sessions, maybe, or one major session and like 6 half-hour sessions. And we're talking about working with people who have a clinical condition or some sort of diagnosis that they're either preventing from getting worse or slowing the progression of or managing. It is very hard to try to get people to commit to a certain amount of lifestyle changes, modifications, tweaks, adjustments that they need to do in their life within that finite amount of time. So that's the stuff that really bums me out. As a patient myself, I've also gone to providers that have caps on things, or the copay is a certain amount, or there's a deductible to be met. And I'm sure this resonates with a lot of people. Mental health is another area as well that, again, it's very hit or miss, and this is where people are in need when it comes to, psychiatric issues and so on. So, Dr. Matthew, let us have it. What are your thoughts about this? Because it makes me bananas. I want to be accessible, but between the paperwork, the credentialing, the approvals, the out of pocket potentially, or the issues, the limitations that are placed on our patient, how can we possibly do everybody justice?
Yeah. So in the world of physical therapy, each profession is a little bit different in how they get reimbursed. Um, Physical therapy notoriously is reimbursed very low because we spend a lot of time, right? We need a lot of time to spend with them. So what it's turned into is the clinics that can actually maintain profitability are bigger, and a lot of them are more corporate now. They You have to see a lot of patients in order to be that profitable for that business to run. Um, the smaller businesses have a hard time too because they don't have as much power to negotiate with insurance companies, so their reimbursement rates go lower. So again, you run into the same problem: is you have to be profitable in order to run a business, but so you have to balance your quality versus quantity in those scenarios. So I ran into, it's, most people see anywhere from 15 to 20 patients a day, right? So 15-20 minutes with each patient, and then you have to do all the documentation. That gives you very little time outside of that to really hone in on what they need, to develop programs for them. So the main thing I see is that the quality goes down. It has to. Like in family practice, those doctors are seeing 25, 30 patients a day. You get 5 minutes with them, right? And it's not the provider that's the problem. It's the system. Because, like I know lots of really good PTs, you can only do so much with the time that you're given. So you make the best of what you can. That's my biggest issue with it. And then I also have a problem with people dictating what they think I should do. So, insurance, those people, they don't have degrees, they don't have the education. All they look at is money. They're the ones making your health decisions for you. I don't agree with that. And I don't agree with them overriding providers. Like, I get why that's there, because some providers and some companies will try to cheat the system. That's just what happens. But in a cash pay setting, my value is based on what I can give you quality wise. Otherwise you're not going to come to me. So I'm not going to make any money. Those places, like, people are telling you to go because insurance is telling you to go, to get an MRI or an X-ray. So it's like you don't even want to be there. So there's that whole aspect. But then you also need a whole team to run insurance. So your value, you have to pay people to do that, or you're spending hours on the phone each day. There's no way a solo practitioner could do both. It would just drive them insane. So then your reimbursement rates keep going lower because you have to pay for that. The battle is, in a cash pay setting, you can only help so many people. The scalability is smaller, your access is smaller. What I find is that people willing to pay for their health get better results because they're actually bought into what's happening. So it's hard because for me, I want to help everybody. So I always try to do what I can, but I've had to realize, like, I'm just not going to be able to help some people. there's a whole rabbit hole you can go down with insurance, but I won't do that.
Right, we might save that for just like an insurance specific podcast episode one day. So I
Yeah.
will say to anyone listening or watching this that if you are having to pay out of pocket and the providers would be considered out of network, just check with your insurance. Odds are we're going to give you what's called a super bill, which is like an invoice or a statement of services, and you could submit that to your insurance company and maybe they reimburse you a certain percentage of that. Or you make accommodations for how to budget around it if you know that you want to go with somebody like Dr. Matthew, who is going to give you quality service and hands-on treatment and set up a very customized program for you. Might be the only person around who's doing that. So, again, you weigh your options. We totally get that it's costly sometimes, but it could be cost effective in the long run. Which brings me to my next question, Dr. Matthew. Typically speaking, what are some of the more common injuries or issues that you're seeing in your practice?
Personally, I've dealt with chronic low back pain, and then chronic knee pain. So I actually see a lot of those things. Most of my 20s, I spent 6 years of it. I was in chronic back pain. And so it was a horrible time. I couldn't do anything. There's lots of stuff that people told me I should do that weren't good options. And that basically I was just screwed. I had an 80-year-old back and all these things. So I hear these stories quite often about people being told, well, now you just can't do this or that. You can't run. You can't deadlift anymore. You can't, whatever it is. There's lots of no's that you can't do. I want to be someone that doesn't do that because your body can adapt and it can rebuild. So that's kind of that's my bread and butter of what I see is low back and knee, but I see a lot of shoulder injuries as well. So like rotator cuff injuries, rotator cuff tears. I don't see a lot of post surgery just because most people, they get surgery, they meet their deductible, and it'll be cheaper for them to go and see someone in person in an insurance based clinic. So I actually see those people later on. A big majority of my patients are people that have been discharged from PT, but didn't get back to the level that they wanted. Because a lot of times, right, insurance covers a certain amount of visits. PT will get them to a certain point, and then they get discharged. And then they can't play basketball or play tennis or go hiking like they wanted to. So that's a big majority of the people I see too, is they got to a certain point, they got better, but they didn't get back to what they wanted to do. That's the majority of what I see in this clinic is a very specific target of I want to get back to this. This is the thing that's preventing me from doing that. Most of the time it's the shoulder, knee, or low back, but I see everything from neck to jaw pain to ankle, foot pain. But those three are probably my biggest.
First of all, I appreciate the discussion around resilience because I do believe in that too. I mean, granted, there might be physical disabilities or mobility issues that people might never recover from, and that's something that you would work around. But it's never too late to start. And in my profession, we obviously focus and prioritize a lot of the food and nutrition. But as we age, and also before we meet what I call that little sweet spot of the 30 to 35-year mark, where if you're not already involved in some sort of physical activity, moving what you can, when you can, however often you can, then your future, you might be paying the consequences of that. So there really is something to say about so many people who want to meet certain goals to manage their chronic conditions will always focus on really restricting certain things around diet and not necessarily including physical activity or even sleep and stress related modifications too, where all of this is very connected. So granted, I always put disclaimers on our episodes. We're not here to medically treat anybody who's paying attention to this episode right now. But if you had to provide some words of wisdom around things like that have to do with the physical body, the physical activity, what might be something that people can pay attention to? And what are some things that you're noticing that might be maybe more common around the injuries that exist?
I'd say my biggest thing that I try to tell people is avoiding pain is your worst idea. Uh, and this goes across not just physical health, mental health, everything. if you avoid something, right, you're never going to fix it. So that's one of the things I hone in on is pain is there to tell you something. You need to figure out what it's trying to tell you and then fix it. There's a way to fix it and there's a way to overcome it, but you can't be afraid to go directly at it. Otherwise, like in the physical health world and the injuries, that's how chronic pain starts is you avoid things because it's painful, but then you're naturally in your daily life, there's going to be things that you're going to have to do regardless of how you feel. So it will come back up and you won't be able to do it because it'll be painful. And then you avoid it more and then it becomes more painful. So like low back stuff, I was a prime candidate of this. It would happen. I would throw my back out and then I would avoid doing anything that would stress my back. Now, anytime I had to stress my back, it would go out again because it couldn't handle anything. And then you do that over time and you become so weak at it that it can't handle, you know, I always tell this story is I went to pick up a loofah in my shower and that's all it took. And, that's as a 26-year-old male picking up a loofah, it's a very humbling story when your back goes out because you can't even pick up a loofah. Those are patterns that people get into, and it's very easy to get into. If you've had pain, right, you don't want to be in pain, but you can't avoid it. And like in the mental health world too, it's if you have an emotional trauma, you can't avoiding it completely is just suppressing it. It's going to come back out. It's going to cause you problems. You have to fix it. You have to head it on and actually address what is causing that in order to fix it, to get it to go away.
Would you, because this is how I think too, because I feel like the mind and the body are very connected in that sense. And so if somebody is, I'm going to use myself as an example here too. If I find that I am super stressed out, I am a chronic back sufferer and a rotator cuff. This is the new thing now. I'm also on another decade. I'm in my 50s now, and I'm like, okay, so I sneezed. I moved aside some clothes in a closet. Like every time I do anything, I'm like, I feel like immediately the pain shooting up. But like you said, it's a way for me to recognize what's going on. But my point being that if I'm feeling stressed out, like if something has seriously stressed me out, if my day's been thrown off, I'm feeling not myself, I'm getting really agitated, it immediately manifests in certain areas of my body that I know for a fact if I do not stop right then and there and address, it's going to make everything worse, whether it's my mood or my physical pain. So the mind body connection, what are your thoughts about that?
Totally in agreement.
Yeah.
Mine also manifests in my low back. I don't know if it started that way or if it goes that way now because I had issues before. Not really sure, but either way, they are connected because chronic pain is a whole different monster than a injury because it's no longer structural. It's a change in the brain patterns in your nervous system. So your nervous system's all affected by stress. A higher level of stress, your nervous system goes on high alert. It creates more problems. That's in a structural sense and how physiologically it works. It would make sense that they would have to be connected if it's a change in the nervous system. The nervous system controls everything. Our mind is directly connected to the nervous system and how it functions. It's hard because so I like sleep and nutrition and stress, all those things impact everything that we do physical health wise too. I just don't have enough time to address all of it. You always try to address some, but that's why I network with professionals that deal specifically with those regions, because if that's a big problem, it needs to be addressed and it will never be fixed if you can't address all aspects. If you've been in chronic pain for a long time, there is an emotional component that you need to address because if you've had chronic pain, it takes a huge toll on you. It changes your identity. It has all kinds of control over you. But if you don't fix that, you're still going to have that same problem. When I treat people with chronic pain, my biggest thing is trying to get their mentality to change about it. I do address it in that regard, but I'm not qualified to do, the mental rehab of it to really overcome that part. But I can help you change the mentality and the thought process behind what it actually means, which will help. but it's not the whole piece of the puzzle.
Yeah, humans are multifactorial. Same on my end as well. I'm not a psychiatrist. I don't have mental health background in my back pocket or a degree in that, but the behaviors or the emotions that people deal with day to day affect their choices of what they're going to make or not make when it comes to managing their food or their nutrition and or exacerbating a particular condition. So I'm very much like you said, right, recognizing our scope of practice and being an interdisciplinary or a part of an interdisciplinary team, which that has often come up in a lot of these conversations too. So if you're listening to this again, if you're listening to or watching this as a patient going through something, these are not quick fixes. This isn't like do this, do that, 3 exercises, or here's a meal plan and you're done. It's deep rooted stuff. It's mindset. It's a lot of patience and compassion for yourself and understanding that your body does need time to heal, even though we're very go, go, go mentality. So allowing yourself to downshift a little bit and allow yourself space to recognize one of those things or whatever's going on that you might have to heal from and address. So hopefully this gives people some guidance towards that direction. I want to find out from you if in your world, is there anything that kind of bugs you, hot topics, current discussions, misinformation, things that you'd like to dispel or address while I have you on with me?
If somebody puts out something and they seem very 100% confident that it's going to fix you, they're probably a gimmick. I'm not going to say with certainty, but it's most likely a gimmick. Because in the real world of change, it doesn't happen in a quick fix. And I think that's the biggest misinformation is we are a society of quick fixes. Like the whole medication route, surgery route, it's all what you think is a quick fix, but actually is not. It causes more problems. Not that those things don't have a place, but they don't restore structure. They just fine tune it to what they can, but it also causes more damage. Medicine does the same thing. It causes different things to happen in your body that aren't naturally occurring. When I talk, I think this is possible. It can fix this. It's because even if I have the same client in front of me, they have all the same things going on and their severity is the same, the irritability is the same, everything. I give them the same things. It doesn't guarantee they're going to have the same result. It just won't. So you can't guarantee those things, and you have to be able to then adjust if you don't get that result. And so I think that's the biggest thing with healthcare is you want to find people that will actually guide you, not fix you, right? Because you can fix yourself. It's like I don't fix people. I guide people to fix themselves. I just help them along the way.
Oh my gosh, I am so in alignment with everything you're saying. No quick fixes, no miracle cures. If it sounds too good to be true, it probably is. However, those are the people making billions of dollars off of everybody because it's a cycle and people keep thinking it's going to work and it does not work, my friend. So
They're really playing
again,
their
yeah,
emotions.
exactly. It's just like, again, right, where you're investing your time, your energy, your money into quality care. And you, as the patient or the client, however you want to term that, you are part of that. Like we are part of your team. You're part of that team. So we have the expertise and the credentials to help guide you, as Dr. Matthew was saying, but you are also an integral part of that success and that it's going to be right. Hello, sorry everybody to break this to you. It's lifelong and it's consistent. So it's not one and done. I'm learning that now too. I'm learning how to make peace with movement. I'm not a natural fitness enthusiast by any stretch of the imagination, but I'm really finding ways to enjoy it and to make it a part of my non-negotiables. So my question to you is so you mentioned before about boundaries. What are some of your non-negotiables? What are things that you try to do in the course of your day or week to make sure that you're staying on top of your own health and wellness?
It's maintaining my energy because I have to be able to do a lot and I have kids and I want to be able to play and you know be there for them as much as I can and for my wife and and my dogs too. And so the biggest non-negotiable is exercise. I have to get in some at least try to get some in every day. My routines changed recently now that I have a big family and little time. my workouts become a lot shorter and just more straight to the point. I've recently brought back in playing basketball, some activities that I really enjoy. Main things are family time, workout time, and then I really need time with my buddies or playing a sport or some sort of community thing. I'm extroverted. I get energy from being around other people. So those are three things that really help me maintain. My nutrition comes and goes. That is something I'm trying to be much more strict on, just because energy wise, it helps me a ton, as everybody knows. But the hard part is emotional eating and when you're tired and you make bad choices. So those are that, and then I've been prioritizing sleep, trying to figure out how to sleep. I don't get a lot of it, so I'm trying to get the most bang for my buck with less sleep. So if I can get better quality sleep, even with the same amount of time, then I'm doing better.
I think you have a lot on your plate, so congratulations for trying to hit a little bit of everything.
Yeah.
And I love what you said too, socializing and being around community, even if people are not extroverted as you might be, that's one of the keys to longevity, like having a sense of purpose and not being isolated, which a lot of us did go through, obviously, in the last 4 years and maybe not come out of, especially if we are working solo or we're still working remotely, to make sure that you do have some sort of connection because it really does help to get out there in among the three-dimensional world and socialize, communicate with other human forms of life. Dr. Matthew, my final two questions for you. What is on your plate today? So, as soon as we are done with our conversation, what's the next thing that you might be working on? And then, if you know it, what is the next thing that you'll be eating?
So I'll do some admin work, and then I have a client at 3:30, and then I'm actually probably gonna go eat right after this. I'm probably gonna go get a bowl. It's called Cafe Rio. I don't know if you guys have that there. It's kind of like Chipotle. It's just a Mexican burrito bowl. I have a meeting with a guy that does personal training for a bunch of. He does a lot with chronic pain too, but a friend of mine. So I'm going to meet with him, network with him.
Well, that's very cool. I'm a huge fan of Mexican food, by the way. I think it covers a lot of bases and it fills people up and it gives you tons of energy. Well, it has been a true pleasure getting to know you, to learn a little bit more about you. I love the fact that we're both connected to Stephanie, and thank you so much for being on here with us today.
Yeah, thank you so much for having me. It was great talking with you, and yeah, we align on a lot of things that we haven't met before, but we align on a lot of the same.
That is what I love about doing this. I get to meet a variety of different people, but we all have somewhat of a common mission, which is to be of service to others and also to make sure people are living as best as they can their great lives. So thank you again.
Yeah, thank you.